Even after recovering from COVID-19, many people report lingering effects for months later. According to a report by Fair Health, a non-profit organization focused on transparency in healthcare, about 15 to 20% of those who have contracted the virus continue to have symptoms months later. 14-year-old Sienna from Cleveland got COVID about a year ago.
My smells came back, but they came back all completely different, distorted and everything. So regular foods tasted like I always describe it as burning rubber, this really weird smell.
Doctors call such a long rehabilitation process long COVID. The World Health Organization calls the lingering symptoms post-COVID.
It occurs in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually 3 months from the onset of the COVID-19, with symptoms that last for at least 2 months and cannot be explained by an alternative diagnosis.
The U.S. Centers for Disease Control and Prevention lists 18 common symptoms, including cough, headaches, shortness of breath, insomnia, heart palpitations, and oftentimes chronic fatigue.
Fatigue is a really common symptom. It's a really dominant one. And the fatigue often is coupled with what patients describe as, quote, brain fog, which would be difficulty concentrating, cognitive issues, cloudiness.
Dr. Linda Zheng works with post-COVID patients at a Stanford University clinic. One challenge is making sure these common symptoms are post-COVID and not something else.
And there's a clear time correlation of persistence of symptoms that they didn't have before COVID, and there weren't other coinciding events that occurred or health changes, then it sort of eliminates the other possibilities.
The number of long COVID centers has mushroomed across the U.S. Social media support groups are also helping patients deal with the mental impact of post-COVID symptoms. Experts say mood swings, anxiety, and depression are very common. Former nurse Lainey Bond says her support group gains an additional 1,500 people a week.
We're really focused on what we would call a nursing patient education.
The U.S. National Institutes of Health have launched a $470 million project aimed at learning more about post-COVID symptoms and finding a treatment. For Lisa Bokaletz in Washington, Anna Rice, VOA News.